Camilla, as a stress management expert, what should we know about our body's stress responses?
The most important thing that I could tell anyone about the stress response is that it is a very personal and individual response. We have our physiology that, we have a certain response to that physiologically, where our heart rate goes up, our blood pressure goes up, our digestion shuts down, we start sweating, those type of kind of normal things that we think about with stress. But what we perceive to be stressful and what measure of stress response we have is a very personal and individual event.
So basically, stress is what we make of our physiological responses, right?
Well, it's easier to think of it this way. When we have our stress response, we have these three different categories, this process that happens, right? And so we have what is stressful that comes in and what we perceive to be stressful. And the important piece here is that the brain will respond to a threat or a stress, whether it is real or not. So if we have something in our memory that we have a previous recollection that was stressful and was dangerous that we need protecting from, even if it's not happening just then, we will still respond as if it was happening. So that's an important piece. But we have the input that comes in, whether it's a stress or a threat, something that comes into our system. And then we have us, right? And like how we are going to process that input and evaluate it and determine how stressful that is and what the appropriate response is. Then we have our output and our response. So when we see these three different steps within this process, the first two are very individual. And what we know from science is that there are two main factors that go into what we perceive to be stressful and how we respond to that stress. And that is our DNA, our genetic components, the generations that came before us, how much stress did they have exposed? Because that does get into our DNA and determine how we are going to be able to respond to this stress. And the other main factor is our experiences. So if you had an experience that was dangerous, that was a threat to you, that will determine how you evaluate what the perception of that threat that maybe mirrors it in the present. So then we also have that's what we evaluate as, that's what we perceive to be stressful. How we evaluate that and how we respond to that is also very individual, because that's really where we talk about resilience. And when we talk about resilience within an individual, what we're talking about are lifestyle factors like nutrition, exercise, meditation, mindfulness, sleep, which is a huge one, sleep, our connections with other people, how many harmful substances that we're drinking, how much alcohol, are we smoking? That really has a huge influence into how we process this. There's also the emotional regulation and how we were taught to regulate our emotions and how we know how to do that. So we have these two components that are very unique. What's stressful to me may not be stressful to you. How I perceive a certain threat may not be the same way you perceive a certain threat. And so those two components of that process are very personal. And then those two together, those equal what we are going to have as an output, what our response is. How do we actually respond to that situation? So a great example is, if you're in the workplace and you have a coworker that you don't necessarily love, that maybe is high conflict, right? You know that when you see them, there's going to be some sort of turmoil, some sort of dissonance. So, you have that person, they come in, they say something to you, you've had a bad experience in the past, you're already expecting it, and you're going to respond to that accordingly. Whereas if it was the first time that person comes up to you, the first time they say something, you may be able to provide a little more empathy, a little more compassion. You haven't yet learned that you need to protect yourself a little bit, because that is going to be a very negative experience. So that's a common area that I see with people, is like, how do we deal with difficult coworkers? And so when we talk about how can you do that, we start by focusing on you as an individual and what you really perceive to be a threat about that person, and what is really the conflict within there. And we break down that stress, and we get usually to a fear of what that person is really afraid of happening. When we look at the big fears of us as humans, we really see that we have a couple of common deep fears: the fear of being alone, and the fear of dying. Those are two main fears. The I actually think that those two things are linked, because when we look at how we have been able to survive as a species for the last, however many millions of years, 5,000 years ago, the only way that we were able to really survive was through cooperation. One person could not do it all. You would never be able to survive in the wilderness by yourself. And so we had these groups of people, these communities, where everybody took a little piece of a different job, and we worked together. And so if you look at it from that standpoint, as survival, that we needed each other to survive, then if you remove one person from that group, and that person was then they needed to hunt for their own food, gather their own food, protect themselves from predators, which is not something that we need to worry about now, but we did in the past. They had to also sleep, and they had to find clean drinking water. Eventually, those requirements would be so overwhelming for that person that they would end up either falling sick from fatigue and sleep deprivation, or they would be eaten by a predator, but they would not survive. So when we look at the fear of being alone and how that is tied to the fear of dying, some people have a deep faith for that fear of dying that alleviates it, but we still have that deep fear of being alone, and it is very powerful. So if you break down that very common situation where you have a difficult coworker, if you can break down what is stressful and get to the root fear, and the way that you do that is by just asking the question, if this is true, what would happen? If this is true, what would happen? If this is true, what would happen? And you get to this deep fear. And a lot of times that is just the fear of being either ridiculed, or not being liked. And that is really a fear of being alone. So when we look at these situations that we're in every day, we can whittle it down to actually a very protecting mechanism that we have that creates a stress based on the fear. And those fears are innate, and they connect us as humans. When you realize that, what you can do then is just see it, look at it, and accept it, and just sit with it and be okay with it. You bring some compassion into it. You bring some love into it, and you say, it's okay to be afraid of this. And you let go of the stress of the situation, and you handle and deal with the fear that is really driving your stress response.
You said a lot of very interesting things there. And going back to something that you said at the very beginning was that our stress responses are conditioned by our genes and our experiences when we were kids. Is My question is, are we all conditioned just to feel and be that way? In what sense? I know that a lot of people might listen to this or even might think about it's like, okay, the way that I react to stress, the way that I show up fear, or the way that I deal with coworkers or things that scare me, this is just the way I am. This is outside my control. This comes from my genes, from my parents, grandparents, great grandparents, and comes from my childhood traumas. There's nothing I can do about it because that's how my body responds. And people tend to attach themselves too much to that identity, and it's hard for them to see that they could change. Is there a way that they can change, and instead of feel that they're conditioned and there's no other answer for them?
Yeah. So your question is well, I think the answer to that is really that we as humans have autonomy. And that autonomy is also linked to understanding why do we do the things that we do. And it's possible to look at, observe our life in its totality, look at our experiences and observe how those experiences shape us cognitively, and also be able to have the autonomy to make different decisions going forward. Now, if there is a lot of trauma, there's significant things that have happened, even in your previous generations, then we have a term for this, breaking the generational cycle, and it's actually a point of conversation now that is super important. And that usually takes a lot of intensive therapy to get to the root of why do I respond this way? Why? And the way that you shift from accepting, or I think what you're saying is there's nothing I can do about it, feeling like there's nothing you can do about how you're responding. The way that you go from feeling like you're not in control to feeling like you do have control is curiosity, and bringing some curiosity to your own self is where we start. And when we talk about things like mindfulness and we talk about things like meditation, what we are training ourselves to do and what we are practicing, and remember, these things are a practice, they're not an event. It is the same as practicing an instrument, learning how to read. We didn't learn how to read by, we couldn't just look at a book and start reading Shakespeare. We had to first learn letters, and then we had to learn words, and then we had to learn how those words work in a sentence, and then how that sentence creates a paragraph, and how that paragraph creates a story. So when you're talking about a practice like mindfulness and meditation, it's the same thing. We need to know where to start. But the hallmark of mindfulness is non-judgmental observation, not being judgmental about ourselves. And when we feel like we're not in control, oftentimes the other side of that is that we are judging ourselves or someone that we love that has similar character traits in a way that is not helpful. So the way to break that cycle is by practicing how to be curious without attaching any sort of judgment or strong emotion attached to it. And that can be very difficult, which is why, therapy and mindfulness oftentimes go hand in hand. And I'm a huge fan of therapy. I think more people should be going to therapy than they are. It's been a huge help, in my life at various points. And it helps to really have that understanding, because sometimes it's difficult to have mindfulness if you don't have the understanding. It's difficult to observe and say these things if you don't necessarily understand what you're actually looking at. And that's where therapy can really help you, is by breaking down and looking and observing in a very safe environment, breaking down some of these behaviors.
I really like that about being curious, because that's what I've been applying to my life. I'm a
Mhm.
very curious person, and anytime that I get triggered by something or that I don't understand something about myself, I'm asking the question why. But I feel that at some point, after you go two, three, four, maybe five layers deep into, okay, why is this happening? Well, this happened because of it. Okay, then why? And then you keep going. At some point, you need to you need to ask yourself those hard questions and get very real and honest with yourself, in a way that the real answer, or the answer that you need and you're looking for, might make you feel ashamed or embarrassed, or just
Yeah.
having a lot of regret from, oh, this is who I used to be in the past. So it is very easy to lie to to ourselves to not go back and avoid that emotion. How can people in those instances, when they're doing the work, when they're being curious, when they ask themselves those questions and get to a point where it's very, very hard, uncomfortable, and painful, to just stick to the process and not fall into the trap of lying to themselves, because that's where the work stops, basically.
It is, and that's where that's where practicing and having a therapist there with you, someone there, like we don't have to go this alone, and I am not a therapist. I do stress management and burnout, but the two go together. And so I think your question is, how do we continue when it gets really difficult? And the answer is very different for everyone, but usually it's a motivation to want something better for ourselves. And we are all a work in progress, all of us. And understanding that that's the game and there is no end game, like this is it. It's about learning and about improving. And it's a never ending, wonderful event that goes through our lives rather than getting to a point that says, okay, I'm here now. That being said, this can be exhausting for newbies. I mean, this can be a very exhausting event, trying to break down your stress to your fear and then dealing with that fear and changing your thought process and moving forward and reframing that can be a very difficult and time consuming process. And I think being mindful of that and being respectful, you also said something, you mentioned the word shame. And the other side of judgment is shame. And shame is a very strong emotion that can drive a lot of behaviors. And breaking down where that shame comes from is a key component to being able to move forward.
Because I feel I've been in that position before when I felt shame or regret, frustrations of my behaviors in the past, or realizing that it was always in my power, but I refused to see it. But I had to get very real with myself. One thing that I've seen from people, from friends, is some of them do the work, or some of them want to do the work, and they go 3 layers deep, 4 layers deep, and then, to me, going the deep is trying to uncover the original story, or the belief system that that is blocking you or just holding you back. And I think for many people, they go 4 layers deep, and then they say, okay, I understand myself, I understand, I'm going to change. And they feel that they have done the work, they feel that they are going to experience a better life. And then maybe a few weeks later or a few months later, they go back to square one. It's just they never truly uncover the root, or the main issue, because they didn't go deep enough. And I think it has happened to me in the past. And I've been It's a long process, it's a lengthy process, where when you it's hard for you to uncover a story when in your mind is not a story, it's just reality. When people face this mental challenge, in a way that, how can I challenge a story, or how can I change a story when in my head is not a story, is how I see the world. How do people become aware of what's real and what's not?
This is a very deep question, actually, and I'll give you what I think, because there's a lot of philosophy in that question as well. Um, but I think that you know, one, talking about other people, there when we respect our own autonomy, we respect other people's autonomy, and we are all on our own path. We are all on our own path. And what that looks like is very individual. And so you said something at the end and I forget what it was.
Probably about how we tell that story is real or not,
Oh, the
or just
reality. The
okay, yes.
reality. So, yes. So the and this is a very yoga answer. We create our own reality. We live in our own reality. And so and a very good example of that is, we can, let's say you are, this is a common situation. Say you're driving on the interstate, driving along, minding your own business. You get cut off. You see this car just like speeding by you, cuts you off, is like weaving in and out of, and you think, what a jerk, like this guy is going to get someone hurt. And now imagine that you had the knowledge that he was trying to get his kid to the hospital. And so what I mean when I say we create our own reality, you see how you would feel differently, and you would approach that person and that situation completely differently with more knowledge. It's not that the situation changed, but your understanding and therefore your reality of the situation has also changed. And so the way that this is tied to mindfulness and observation is, we also talk in that same breath empathy and compassion and self-compassion. And so empathy is understanding that there is somebody else is suffering. So in that situation, bringing empathy to it would say, even if you didn't know, you could say, there may be a very good reason why that guy is driving that way. And therefore you can feel, because there's no sense of anger anymore. You now have compassion, you have some empathy towards that person. Then you're actually going to feel that stress response decrease just by bringing empathy to it. Compassion is different than empathy. Compassion is acting. So, in that situation, acting could just be kind of maybe, staying the course so that you decrease your own risk of being in an accident, and say, okay, I understand that there might be something going on here, and I'm going to stay in this lane. And that's what I'm going to do. So when we talk about what is real and what is not real, we can create the perspective of what we see of the facts in front of us. Our perception of that and our perspective of that is shaped by our history and our understanding. And it goes back to when we talk about stress and we talk about threats and we talk about danger. Our reality, some people have lived in a very different reality than others, and that's where we are conditioned by what has happened to us, because our reality of a situation is based on the information and the memory and the knowledge that we have that affects what we think of the present situation based on our past. Does that make sense?
Yes, I've always heard that perception is the stabilizer of the mind. Is the way that we interpret certain situations. It's just, it is up to us whether, as you said, somebody's driving like crazy. We can be angry at that person for being reckless, for putting other people in danger. But
And
then at the
rightly
same time,
so, I will
yes,
add. Rightly so.
yeah,
Yeah.
true. But it's all about what story you feed your brain to that particular event, which takes me to a point when it comes to stress responses. It's like most people have a negative relationship or a negative concept around stress, right? And my understanding is, when you experience a lot of stress and you have a negative relationship with it, or think that stress is bad, then you can eventually get sick. It's just your brain is releasing chemicals because you're in survival mode. But at the same time, you can have a positive relationship with stress when you're exercising, or when you are excited about something, or when you are working hard, and then you'll feel motivated. And those people, those who have a more positive relationship with stress, don't get sick, even though in fact the brain releases a different set of chemicals, even though the physiological responses are very much the same. It's like somebody who's anxious and somebody who's excited, it's the same physiological response, but one will feel much better than the other one depending on the story you tell yourself. Based on that, how can people reframe stress and start changing that brain biochemistry?
Well, so I think there's I'm gonna challenge a little bit of that language, the good and the bad stress, because stress is stress, and our physiological response to that, and that's where the connotation of what that stress is and our experience with it can have a more significant negative response rather than a neutral response. What you are saying as far as exercise and these things, this is what we're talking about when we talk about resilience. And when we talk about resilience, this is how it's tied to that. What we are talking about is your ability to not just be able to decrease what is perceived to be stressful, but also mitigate that stress response when it comes in. And so stress response is just a physiological response. And it is something that has protected us for many, many generations. But it's supposed to be a short term event. And when we have constant stress, when we have a bombardment of stress and we are not able to recover from that stress in a way that adequately measures the amount of stress coming in, then that's where we start seeing what's called allostatic load, which is when the response to that stress takes more energy than the stress itself. And that's where we start seeing things like illness and sickness. That's where, your cortisol levels get very high over a long period of time, and that can affect our cognitive abilities, that affects our heart rate, that affects our digestion. And so it's not so much the stress, it's the amount of stress that comes in and how well we can manage that stress when it does come in. And so resilience is being able to build more tolerance to what we think to be stressful, and also to be able to manage that stress in a more efficient manner. So if we look at stress as just a physiological process like metabolism or our heart beating, that it makes a little bit more sense that we can do healthy behaviors and we can have healthy lifestyle choices that improve our ability to manage that stress when it comes in. But chronic stress is very different than an acute stress. And chronic stress does happen when we have over like a bombardment of stress on a daily basis. So if you're working in a very stressful environment, you're in a very stressful relationship, it's a stressful period of time for you, there's an illness or something like that, then there isn't a reprieve of your body to be able to actually recover from that stress the way it is set up to do. And so we have an overload of your body's trying to handle it, and it just can't do it.
One thing I've experienced a lot in my life. Well, first of all, I used to be still a little bit addicted to stress in a way that if I'm not stressed, I feel that I'm not being productive, and I need that stress just to keep me going. But when we're stressed, when we are resentful, when we're angry, when we're sad, when we depressed or feel unworthy or just hopeless, our bodies, as you mentioned, are in survival mode, right?
Mm-hmm.
We are in a sympathetic nervous system, and getting out of it is so hard. When we experience those moments, when we experience that physiological response, it doesn't necessarily have to be related to stress. As I mentioned, it could be anxiety, it could be sadness, it could be feeling of unworthiness. What techniques can we use to pull ourselves out of that state and go back into a more parasympathetic nervous system?
Yeah, it's a great question. So we'll just do a quick breakdown of the science so that we can have a foundation here. But you have two main, what we call autonomic systems in our nervous systems in our body. We have the sympathetic nervous system and the parasympathetic nervous system. And these are the systems in our body that do all the stuff that we don't have to think about. Our heart beating, our lungs breathing, our food being digested, those are temperature being regulated. Those are the autonomic nervous system. And in a very broad sense, and I'll keep this very broad, the sympathetic nervous system is was traditionally considered the fight or flight. That is our fight or flight response. And the parasympathetic is traditionally thought of as our rest and digest. Over time, there have been some additions to that, but we're just going to keep it kind of old school and basic for right now. Those our sympathetic nervous system and our sympathetic response to stress is automatic, right? And so that's where like input, evaluation, output. The only way, and the parasympathetic nervous system helps to, they balance each other out, right? So like the parasympathetic nervous system will help slow down the heart rate, whereas the sympathetic nervous system will help speed up the heart rate. The parasympathetic nervous system helps slow down the breath and our breathing rate, and the sympathetic nervous system helps speed up. Because when we are attacked by a lion, we want all of those things to be working when we have that fear response. The only way that we can consciously activate our autonomic nervous system, so either the sympathetic or the parasympathetic nervous system, is by breathing. We cannot consciously say to our heart, I want you to speed up, I want you to slow down. We can do things that will create that. We could exercise, which would, we could start running, which would increase our heart rate. But we can't consciously, just with our minds, do that and with our actions. So the only way that we can tap into the autonomic nervous system is through breathing. And so that's why breath work is so powerful, because that is your gateway to the parasympathetic nervous system that helps to balance out our sympathetic response. And breath work has been around for thousands of years. In yoga actually has 8 limbs to it. And one of them is pranayama, which is life force, the movement of life force, which is all controlling your breathing patterns, and your retention of that breath. So these in breathing and breathing exercises have been around for thousands and thousands of years. And controlling your breathing rate is one of the easiest, fastest, and most effective ways to getting your body out of that stress response and into a parasympathetic response.
And what would be one of maybe one or just two of these breathing techniques or
Yeah.
patterns that we can use to regulate our nervous system?
So there are some, just we'll go over just some foundations. There are some breathing patterns that have actually been studied, one called 478 that's been studied, that has been shown to decrease, your perception of stress and the stress response. But what we're going to do is just make sure that everybody has a good solid foundation of the basics. And when you're doing breath work, for the most part, what we want to do is breathe in through our nose, so with our mouth closed, so in through our nose and then out through our mouth. That's one thing. The second thing is we want to be sure that we are engaging our diaphragm, which is a muscle along the bottom of the rib cage that contracts and relaxes and allows the lungs to open up and close, and allows the air to come in and close. And so breathing in is an active act. Passively, we are just going to breathe out. So the effort is actually in the inhale, and the exhale is very passive. So we want to breathe in through the nose. We're going to breathe out through the mouth, but then you can put one hand on your belly and one hand on your chest to make sure that you're activating the diaphragm. And you can know that you are activating the diaphragm and getting the full lung field is when you breathe in and your belly's going to come out a little bit. So what that means is the air is coming in through your nose, down through your lungs, those lungs are expanding, and your belly is moving out of the way as the diaphragm contracts. I also like to bring your awareness to the sides of your torso here too, and expand that breath. So what it would look like is we could put a hand right on our chest and a hand right on our belly, and we take a breath in and breathe out. And what we want is to start bringing our awareness into our body. And so when you breathe in, you're going to feel that cool air in that breathes, that comes all the way up into the nose, all the way down through the back of the throat and into the lung field and expands the lungs and then comes out. So it's a very rhythmic, gentle practice. And so if you can just take 5 to 7 deep breaths like that, and then exhale, and the other key is you want your shoulders, like this neck shoulder area, to just be able to let go. You just want that to let go, because that's where we carry so much of our tension. And for relaxation, for calmness, a little tip is if you were to count for your breaths in and your breaths out, you want to actually exhale longer than when you inhale. So if you're going to inhale for like a count of 4, you're going to exhale for a count of 8. And what that does is that helps to promote that calmness and that relaxation. Now, the 4-7-8 breathing that I mentioned has a retention. So the 4 is a breath 4 in through the nose. The 7 is you're going to hold that breath, and you're just going to stop that breath from moving. And then the 8 is you're going to exhale through the mouth 8. So it would look like this: 4, 7, hold, 8. Yeah, I mean, you can feel it immediately. And one of the best things about this is nobody knows. You could be very nervous about a meeting or a presentation or something, if you're stuck in traffic or you're irritated with the grocery line. You can practice this and you can calm yourself down and nobody knows. It's just you. So it's just such a great way to tap into that parasympathetic nervous system to help pull us out of that stress response. And I will tell you another thing. I have a 4-year-old, and this is something that we practice with him when he gets upset, because anybody that has 2, 3, 4-year-olds knows that tantrums are a part of the deal. And one of the things that I have found with him is when he's upset, I hold him and I don't even say anything. And I just start breathing deeply, just like that, in through my nose and out through my mouth. And I just hold him, as he's doing his thing. And I would say on average, my 4th to 5th breath, he just starts breathing with me and he calms down immediately. So breathing exercise is actually becoming part of a parenting strategy as well. And it has worked remarkably for us. And he was really upset the other day. My husband takes him to his little preschool in the morning, and we had forgotten something that was just a travesty. I forget what it was. One of his stuffed animals, and he just could not be calmed down. And my husband's in the front seat and he's in the back seat, and he calls me, and I was like, just start breathing. And even without saying anything, got off the phone, and my husband just started breathing in like that, in through the nose and out through the mouth. And my little one just picked it right up and calmed down. So there is a lot of value here to be able to pull us out of that situation and put us back in our bodies and a little bit more out of our mind.
Yeah, I think that it's a very simple thing that many
Mm-hmm.
people feel it's kind of pointless, but and
Mm-mm.
we tend to forget. In my case, I tend to forget, and it just we don't myself. I feel that yeah, I feel that the answer should be more complex, and in reality, most things in life, how you get better, how you feel better, how you improve, whatever. The answers are pretty simple. You just have to apply them, and it just having that reminder that every time that are having the capacity and the awareness of, okay, I'm feeling this. Let me start breathing, and then I can just calm myself down, because we have these weird belief that once we feel it, we need to feel it to a full extent and feed it and keep feeding it, and just be even more outraged or more stressed or more or 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 angrier, or I don't know, just all these feelings, when reality is like, uh, there's no need to do it. We can pull ourselves out of it. It's our choice at the end of the day.
It's an important piece, I think, to recognize that all emotions serve a purpose. But emotions are supposed to be a fleeting thing. They're not necessarily supposed to last for a long period of time. What they're supposed to do is give us insight into the situation so that we can respond. And so all emotions, feelings never lie, and emotions never lie. They are true. Where our minds kind of work against us sometimes, and this is part of having a prefrontal cortex that helps with executive function. But we try to justify or fight that which we are feeling. So if we are angry about a situation, oftentimes the other side of us, the other side of our brain, is saying, well, you really shouldn't be angry, and here's why, X, Y, and Z. And then this side of the brain is saying, yes, but I am, because of A, B, and C. And then this side comes back and says, yes, but do you remember X, Y, and Z? And this side comes back, and we have this back and forth. And so that tension that we create in our minds oftentimes makes those emotions and that stress response persist much longer than just saying, you know what? Yeah, I'm pretty angry about this, and that's okay. And you know what? I'm going to be angry. I'm going to be angry for a few minutes. I'm going to see why I'm angry, and then I'm just going to sit with it and let it be. And when we accept how we feel, when we accept those emotions and we don't judge ourselves for feeling them, they last much shorter and they have much more control over our actions.
Yeah, one thing I've noticed, not only from me but from people close to me, family members, friends, is like people are divided in two buckets. One is those who feel the emotion, who feel the feeling, and then try to bottle and just like ignore it and just bury somewhere. And then there are other ones like me that once I feel the feeling, I start feeding it because I'm supposed to feel it. But instead of lasting for a couple of minutes, maybe five, maybe 10, now it can last several hours because I keep thinking about it. I can start feeling. I feel, I feel. And this eternal cycle that instead of stopping, it's like, okay, I don't have to be angry anymore. Or just I don't have to be sad anymore, or I don't have to be anxious anymore. The more I feed it, the more reasons I have to feel that way. And then you enter in a realm where that survival response that should last just a few minutes to keep us safe is lasting several hours, even in some cases with some people several days or even months, when they are constantly angry or constantly sad or constantly anxious. And having that understanding that it doesn't have to last that long, one, but also you don't have to bottle them up and just feel it. I think most people are struggling with that. They either do one or the other one without just letting it be and move on from that emotion.
The other key component here that we haven't touched upon yet, though, is you also have to feel safe. You have to feel like it is okay to feel what you're feeling. And if we have not created that for ourselves, or it has not been created for us, then it can be a very scary thing to feel feelings that we have learned was not received well. So creating and allowing ourselves to feel safe feeling those things is also part of it. And you know, when we get in that tug of war with ourselves, one of the things that you can do to kind of help pull yourself off, right? We talk about self-evaluate or being self-aware and observing and being curious. It's one thing, you know, in my mind, I always say, you know, we use the first person, like, or you, right? Like, you can't do this. I can't believe I did this. I can't believe you did that. One of the easiest things you can do is call yourself by your name. So if we are in a situation where I did something and now all of a sudden I don't think that, oh my God, I can't believe I did that. No one's going to like me, this and that. It was so stupid. I can't believe I did it. Like these things that happen to all of us, this internal dialogue that happens to all of us. Stop and use your the third person and say, Camilla, you are so stupid. Camilla, I can't believe you did this. Camilla. And immediately you will notice a detachment from that because we don't talk to each other that way. And it separates in your mind that sense of your identity that you did something to the behavior that like this is somebody else that we're talking about. And it allows you some space to observe rather than to be in it completely. And so that's where when we talk about this observation and we talk about being curious, like being able to kind of remove ourselves from the situation and being able to observe it without judgment can start by just putting a name to it. And you don't have to call it, you could call that internal voice something else. You could call it Steve or Joe or whatever you want, but something so that you recognize that that's not you. That is just your mind telling you something, saying something. And it's not a reflection of who you are as a person, because inherently we are all very special, very beautiful, very unique people. And who we are in our essence is different than sometimes the person that we create in our mind.
Yeah, I think that detaching is very important and under underutilized because I feel like many of us, we just, as you said, we talk ourselves in first person, and if we just talk like we were talking to a friend, like we
We would never
refer to the
accept
person
it.
exactly. So that is a very important thing that I should and other people should start practicing and see and just experiment and see what your emotional response to that is. But speaking of this emotion, we have touched a lot of the negative ones. One thing has been the biggest challenge for me has been at least lately is I'm not familiar from a physiological response with positive emotions. Call it joy, call it happiness, call it gratitude, right? And it's hard for me to create that emotion in my body. It's just like we can our body doesn't know what's real and is what in our head. For instance, if we're thinking about an argument that we're going to have next week with our significant other or with our coworker, our body gets ready and feels like in the moment, whether it's just frustrated or angry or whatnot, we can teach our body to feel the emotion even though we are not at that particular event. But the same thing, we can do it with positive emotions, which by the way is kind of key for manifestation. When it comes to that, when it comes to creating these emotions with the power of thought, and we're not familiar with it, how can we do, or at least in my case, how can I do to create those and become more familiar with an emotion that is not very that I don't experience very often?
So your question is, how do you start promoting more positive emotions to help manage the negative ones and
Yeah,
therefore decrease your stress? Is that
well,
kind of the thought?
sort of, because here's the thing: I can think about positive things. I can think about things I'm grateful for. I can think about things that some uh, happy memories, but I can think about them. I don't feel them. See, but on the flip side, I can barely think about something negative, and right away I'm feeling it.
I
So
understand.
I want to be able to feel the positive emotions when I'm trying to think of positive thoughts, I guess.
So I understand. And I would say to that, the kind of hallmark gold standard good feeling, if you will, is love. And my meditation teacher, who I had for several years, he always ended the meditation sessions. It was always over Zoom, and he would always end them with, "Allow yourself to feel love." And when we give ourselves permission, I would start with that. And this is where the meditation can really be helpful, is because we can guide you into this place where you are allowing yourself to feel that love, not just love from another person, but also the collective goodness of humanity and our society and other people. And harnessing that energy, I think it starts there with that. And we also, that concept of creating space for those emotions, creating and allowing ourselves to feel these positive emotions, it's much easier to be protective than it is to be proactive with these positive emotions. And we are really ingrained to survive. And that's where, in our brains, the fear response leads to the stress response, because, the fear of something leads to the stress response, because that's how we were able to survive. And so the counterpart to that is allowing ourselves to connect with other people and allowing ourselves to connect with ourselves. And the foundation of all of those things, of all good things, is love. So I would say start there and really allow yourself to start feeling that. And then other emotions, joy, excitement, happiness, all of which are very different, subtly very different, will be much easier because you've already built in the foundation of all of those other emotions by just accepting and feeling that love in your whole being. And when we do meditations, the way that starts is your heart. Your heart is actually the center of that. The heart chakra, you've got your chakras, is actually love. And so it starts from there and it just beams out from all of us. So that's what I would say, start there. However, I would also just mention that living in the past or living in the present, whether good or bad, is still not living in the present, or in the past or in the future, is still not living in the present. So part of how you can enhance your experience in the moment, and this is, we talk about being present and we talk about being in the moment, but we don't have a lot of skills to get there. So I'm going to teach you one to start. And this connects mindfulness when we talk about mindfulness. And the way you can do that is invoking all of your senses. So when you are sitting, and I encourage you to just have some space before, sit and just practice this on its own before you start doing tasks. You can do anything mindfully. You can mindfully fold the laundry, you can mindfully, but start by just practicing what it feels like to invoke your senses. And so as you sit there, as you sit here, start with your hearing and open up your ears. You're really going to think about opening up your ears. And you're going to hear 5 things. Look for 5 different sounds. And they can be very subtle. It could be the wind blowing. It could be a wind chimes. But really pay attention to 5 sounds. And then you're going to do the same thing with your smell. Really breathing and try to decipher different smells, 5 different smells. And the same thing with taste, in your mouth, like, what do you taste? Where do you taste it? Did you, I was actually practicing this. We live by the water, so we have a boat. And we were just riding around and I had a piece of dried mango. And I could feel it, but all of a sudden I could taste like which part of my tongue the sweetness came from. And it tasted so much sweeter. And then the third thing is your body in space, your touch. Feeling the seat beneath you, feeling the floor beneath your feet, feeling the air around you, feeling where your body ends and the air begins. and then sight. And this one you can do two ways. You can either close your eyes and you're going to focus on your mind's eye, which is right in between, right where your eyebrows meet, or maybe don't meet. Um, and what you're looking for is, what you'll see is like there's still colors there. It's not just black. You'll see some white and you'll see some purple and you'll see some blue, and it will constantly be moving if you're looking at it when you close your eyes. And so just, 5 things that you see, or if you want to keep your eyes open, look at one thing. One thing. Like I have a jar of honey on my kitchen table. So like, what do I notice about that? Like, what's the shape? What's the color? Like, it's situated on the counter? And so what happens when you invite all of your senses in is that you have to focus so much on just that your mind doesn't have the space or the bandwidth to do anything else. And that means you are immersed in whatever you are doing at that moment.
Yeah, I guess it's just, well, I knew from get go that it is a practice, and at the beginning, even feeling that love or being more present is going to be challenging at the beginning. Our minds are going to be wandering between the past and the future. If we are trying to live in the present, if I'm trying to feel love, I won't feel anything at the beginning, because it's like a muscle. It just requires a lot of practice. I just need to be, I guess, more patient about it. But now that I know exactly what behaviors can I start um, engaging into, then I can see myself, okay, if I remain consistent and disciplined with this, I can eventually start feeling those positive emotions from a physiological standpoint, which is really what my goal is. But now that we're speaking of behaviors and concepts, we have touched the concept of mindfulness, of self-awareness, even self-love, and we sort of understand what they are, what they mean. But when it comes to doing it ourselves, like, exactly, it's like, okay, I understand the concept, but I don't understand how can I apply it to my life. We don't. That's, I think, most of us struggle and not applying this into our life because we don't know exactly how to behave in a mindful way, or what we need to do to behave in a way that we can gain self-awareness. How can we deconstruct these concepts into behaviors that we can apply into our lives?
Well, so I think the first thing that we need to do with ourselves, and this comes from just years of working with patients and years of working with myself, you got to give yourself a break. I think you have to give, we have to allow ourselves the fortitude that we are doing the best that we can. The other, the other component that helps tremendously is to trust the path that you're on and that you're in the right spot. And that anxiety that comes with the future and not knowing the future is in large part because we don't want to screw it up, and we want to avoid anything painful. And when you have intrusive thoughts, postpartum I had terrible intrusive thoughts. um and you just kind of feel like, all right, if I think of all the wrong thing, all the bad things that could happen, then I'll be prepared for all of them. And so even if they do happen, I'm prepared. But that creates in the present a lot of fear because you're living that. You have to live through that, right? And that goes back to what we were talking about with creating reality, is that you're putting yourself in that future and living it and feeling it so that you know how to respond. So I think we need to trust in ourselves that where we are right now is exactly where we need to be. And that takes a lot of pressure off. In order to do that, we also have to feel like we are in control and we have autonomy. So when your question about like how do we actually bring it to the present, one, it's not an event. As we said in the beginning, like this work is a practice. And where you are starting is exactly where you need to start. And so if you have a goal to get to, that's great. Write it down and work towards that goal. And then if you want to, set another goal. But whether you can sit in meditation for 30 seconds or for 30 minutes, both of them are okay. whether, what you've learned today helps you stop and actually enjoy your coffee, or stop and enjoy the company that you keep, enjoy petting your dog and just do that, because dogs are fantastic. That's great. That's a step in that direction. That's a step in the right direction. So accepting where you are and meeting yourself there, and not setting these expectations that you should be somewhere else, is one of the first steps that we take when we are trying to practice mindfulness on a daily basis, because we give ourselves that space, and we give ourselves that grace, that where we are is great, and we are learning new things. But Camilla today is just as good as Camilla yesterday, even though I learned new things today. And that doesn't mean that we will be, I will be a better tomorrow. I don't know, but we're still moving in that right direction. So I would say whatever practice, and there are resources which I think you're going to have. There are some great free resources that have mindfulness. Insight Timer is one of them. I have a page there, a bunch of free mindfulness and beginning meditations and mindfulness practices. So there's really great ways to start incorporating them. But even if you just stop and taste your food, or you put your phone down and you stop watching TV while you eat, that's where like mindful eating is a thing, and where you're really like tasting and smelling and feeling the texture of your food. That's what you're doing that, and you're doing that where you're making a choice to actually do that instead of something else, and that's great.
Yeah, I think, oh, a couple of things. One is that it's okay to where you are right now. And then, because for many years I felt like, okay, I'm behind, I'm falling behind, I'm falling behind what? Who knows? But it's just a feeling I have, right? So it's like, okay, just give myself more grace and be more kind to myself, more gentle to myself, and say, hey, you're going to make it. You're going to, achieve your goals or be happy or any of these things. And it's not that there is a lot of sense of urgency for no reason. It's just something that we need to, or at least in my case, I need to just reframe and change. But the other thing about mindfulness is that we have all these distractions, our phones, and we cannot have. It's hard for us to allow ourselves to have, idle time where we can just be within our thoughts, or just doing an activity without getting bombarded with content that will spike our dopamine levels. And I think that's an addiction. I can tell. Every now and then I'm addicted to just scrolling, and just because you either see funny videos or dog videos, and then that creates more and more of that good chemical, sort of makes you feel good, but at the end of the day it's not helping you. And yeah, I just
Well, I would actually, so this is where what you're saying is we can tie that to the awareness, because um, I also scroll and I love it. And I understand that that they've concocted the algorithm to make me feel as good as possible, to keep me on there as long as possible. But yet I put a clock on it and I recognize it. And so if you are aware of what is happening, if you understand like what role is this playing on, in my life, like one of the things that I do at the end of the day is I crawl into bed and I watch a really entertaining show. And for me, like that's great. That's how I, can unwind. But I would never do that all. Actually, I have done that all day. Just kind of binge watch.
we all
But
we all have we
you
all
can't
have
do it
we all have,
I can't
we all
do
have.
it every day. Yeah, we were binge watching Ray Donovan while I was in labor for 3 days. That's what we were doing in the hospital. But you can um, you you can just recognize the role that everything plays in your life. And I think where we get into trouble is when we don't recognize what's happening. We don't recognize like what is actually giving us good energy and what is maybe taking energy from us. And so allowing those things that we enjoy in life is definitely a part of it. but being aware of what role that is playing in our life and also the effect on us so that we can make an educated decision about how we want to spend our time, that is really important. And it but if you're not able to take a step back and not be judgmental about what you're doing, that, maybe scrolling for 30 minutes is fine, but maybe an hour isn't fine for you, then it's easy to get caught up in it. And then we feel a little out of control. And then we start shoulding ourselves. We should do this. We shouldn't do that, Whereas if you just recognize what it is, you give yourself permission to have that space for whatever you're is enjoying it, then have at it.
Yeah, a big part is being able to control our impulses, and as you said, being aware of, okay, we're being scrolling for 30 minutes for an hour. Okay, it's just time to stop at doing other things, and it's
Mm-hmm.
just having that discipline of, even though I'm enjoying this, I need to stop and I need to do something else. It's not that I need to be more productive. Even if if just sit with myself and not do anything and allow myself to be bored, is better than scrolling nonstop. Camilla, I've been enjoying this conversation a lot of insightful things, a lot of
Thanks, Dan.
fascinating information that can help a lot of people. But as a closing question,
Sure.
what is something that matters way less than you thought it would?
In my life,
Yes,
personally,
personally.
oh, um, I would say, you mean like in the past few years?
Something that you used to almost like either a belief system or something that you thought that it mattered a lot, and
Oh,
then nowadays you feel, you know what,
yeah.
it's not that important.
I would say one of the key shifts for me was when I distinguished between achievement and success. And so when I was able to do that, because oftentimes we equate the two, we say when we achieve, we are therefore successful. And that puts a tangible component to success. Whereas success to me is having healthy, happy family members, healthy, happy kid, happy, healthy marriage, um, professionally achieving certain levels are great. I'm very good at goal setting and reaching those goals and working towards them, but I do not confuse the two anymore.
I love that answer because if we attach achievement to success, then if we don't get that achievement, then we're not successful. We're not successful. We're not happy. We're not happy. Then
Yeah.
all hell breaks loose. So I really, really, really love that answer, and it's something that you can you, if you have, and everyone has a different definition of success. Is one of the most subjective concepts that we have because everyone has a
That's
different.
exactly the point.
Yeah.
You're 100%. That's exactly the point, is that we can create our own levels of success, but society has achievement markers that we have, like graduating college, graduating high school, getting married, like these things that if you don't necessarily achieve or want to achieve, does that mean you're less successful?
Pretty much you can create your own definition of success, as we
Mm-hmm.
talked about, and it's up to you basically to feel you can be happy, okay, or you can be miserable. It all depends on the story that you feed yourself at the
Mm-hmm.
end of the day.
Mm-hmm.
Camila, once again, total pleasure, awesome
Thanks, Dan.
conversation. But where can people find you if they want to work with you, if they want to follow with your work, all of that?
Yeah, thanks. So they can go to my website, thewellnesscabinet.co, not .com.co. And what I do is I run the SMART program, which stands for Stress Management and Resiliency Training Program, which is a certified program out of the Henry Benson Mind Body Institute at Massachusetts General Hospital and Harvard Medical School. I'm a certified clinical instructor. And so you can join our group. You can do that class with me there. You can also find me on LinkedIn and on Instagram at Dr. Camilla Moore.
Awesome, perfect. I'll add all of those to the video, show notes, YouTube
Awesome.
description. And once again, thank you so much for this
Thank you so
conversation.
much.
It was a pleasure.
Yeah, thank you. That was great. Thank you so much.